All right, let's go ahead and discuss your incision and drainage. So you've got a patient, this is your 65-year-old patient that is here for an IND because they do have an abscess on the right lateral aspect of your thigh. You got a good history, and you want to be sure that you're covering for antibiotics once you're done with your IND. All right, so the first thing you want to do would be to assess the abscess, really just making sure that this is not a deep abscess, that it doesn't have any tunneling. So you want to make sure that you're assessing that it does have the central fluctuance. You can see the induration. You want to check around and make sure that you have that central fluctuance. That's really important, right? Okay, and then you also want to make sure that this patient is a good candidate for your practice. And once you're determining that you're going to perform an incision and drainage, then you want to go ahead and gather your supplies. So here I do have your number 11 blade. Okay, I have my Lidocaine, so that's Lidocaine with epi. And I do have my hemostat. Okay, and of course I have to get a wound culture, so I do have my culture right here. Okay, all right, so I'm just going to go ahead and cleanse that abscess. So I start from the clean area, so it's going to be inner to outer. So I'm just going to cleanse the one time. Okay, I'm going to repeat that, inner to outer, and I'm using some chlorhexidine right here, just cleansing that abscess. And then I would cleanse again for the third time. Okay, so once I'm done with that, I will go ahead and inject my Lidocaine, and I'll use a field block, so pretty much going at a 30-degree angle, bury my hub as much as I can, aspirate, and I'm going to infiltrate my Lidocaine as I'm pulling out. Okay, and I'll do the same thing on right here, so 30-degree angle. I aspirate, and then I infiltrate my Lidocaine as I'm pulling out. And I'm going to make sure that I do not get into the abscess, because this is an acidic environment, so you want to be sure that you stay just right there at the wound margin. So again, I will go ahead and bury my needle as far as I can go. I infiltrate. I always pull back before I infiltrate. So again, you infiltrate as you're pulling out. And I have my fourth field right here. So again, just the same sequence. Aspirate, infiltrate my Lidocaine as I'm pulling out. And then I have to wait about 10 minutes. All right, so now 10 minutes is over. So I'm gonna have to ask the patient, Ms. Jones, do you feel any pain pressure? Just pushing down on the abscess, and hopefully the patient is nice and numb. You want to go directly on the abscess itself, because that's where you'll be making your incision. So right here, do you feel any pain pressure, Ms. Jones? And the patient says no. So now you're just going to get your number 11 blade. So take your number 11 blade and go directly in the middle of the abscess and make that incision. Okay, so you're going to go deep and go wide. So you're actually going to make a nice cut. Remember that you have a pocket in the abscess, so you want to go deep and wide. Okay, and as much as possible, get into that pocket and break it open. All right, and once you're done with that, then the next thing you want to do would be to make sure that you get a good culture. Okay. So I just go ahead and I go right in the middle of that abscess, and I get a good sample. I'm going to send that to the lab. All right, so the next thing I want to do would be to use my curved hemostat, and so I'm using the hemostat really to go in there and break up all the localization. I don't want anything left behind, so I'm just going to go ahead and break up all that pocket that I have right in the middle of the abscess. So we call those pockets loculations. Go ahead and break those open. So I go at 12 o'clock and this will be your 3 o'clock. This will be your 6 o'clock right here using the face of a clock, and this will be your 9 o'clock. And so once you're done with that, then you want to go ahead and squeeze as much as you can. Okay. All right, so use your 4x4 and squeeze, squeeze, squeeze. Squeeze that abscess. Get as much out as much as you can. Okay. All right, and make sure you have a face shield and protect yourself, protect your face. And once you're done with this and you've got all the abscess out as much as you can, then you may want to consider just irrigating that abscess. So you can get your 60cc syringe with some normal saline and just irrigate irrigate as much as you can. And once you're done with that, get your packing gauze, and you're going to pack the abscess as much as you can. You want to pack loosely. So again, you want to pack in such a way that you do not you don't make it too tight. So really just get that packing gauze and pack the abscess as much as you can, and then use your 4x4 gauze and cover, apply your dressing, and you're done. So that's how to perform an incision and drainage for an abscess.
Hey, thank you so much for watching. If you enjoyed this, there's plenty more where that came from. Be sure to check out similar videos on our YouTube page. And don't forget to like, comment, and subscribe, and we'll see you next time.